The documents are several pages of notes and emails obtained through access to information requests by the NDP. One of them is an email from Assistant Deputy Minister of Health Mark Wyatt. It was sent out 2 days after the budget came out in March. And in it, he asked several higher-ups in the department for their thoughts on what the impact of losing STC may be. He also asks questions about how to coordinate medical taxis and whether closing STC would create a significant gap. Now, the fact that he was asking these questions after STC was already cut isn't sitting well with the NDP.
The FOI illustrates very clearly that they didn't know the impact of this decision. I think if you're making a decision in government, that you should know what the impact of that decision is.
When asked about the impacts, the health minister accused the NDP of trying to use scare tactics. He pointed out many Saskatchewan communities didn't have STC at all.
Less than 1% of the people in the north, for example, used STC to go to medical appointments. Mr. Speaker, other arrangements have been made. Courier services are used to provide delivery for necessary items. Mr. Speaker, the rest of the country operates their healthcare system without using a government-owned bus line, Mr. Speaker. We can do the same.
As for solutions, according to the briefing note, many branches were tasked with investigating the impact of losing STC. It explains courier services could be used to ship drugs, although likely at a higher price. It also suggested cancer patients could use telehealth services closer to home. The minister says he understands there will be some gaps, but he says those can be filled. Mickey Cowan, CBC News, Regina.